Moore, owner of Total Performance Physical Therapy. Today we're going to talk about ice and does it reduce inflammation. So a lot of people are always confused. Do they use heat? Do they use ice? Do they not use anything? Should they take Advil? This is a big question we get a lot of times, and it can make a difference in your healing. But is it going to damage anything? No. I think there's a lot of scarcity of using heat or ice because people are so afraid they're actually going to cause more damage. If you're putting heat or ice on for, 10 or 15 minutes, it's not going to make a world of difference either one way or the other. Ice is designed to reduce inflammation. So if you have a swollen ankle, if you have pain, it actually can reduce some of that swelling. It is not going to reduce everything. It is not going to be the miracle drug, but there are things that are traveling in your blood that are causing some of that inflammation, some of that pain. And what that ice can do is actually reduce the flow of blood. And with the reduction in the flow of blood, that can reduce some inflammation, that can reduce some pain. It is advantageous, if advised by your doctor, to move. That's the ultimate reduction of inflammation, is movement. And anything that sits still is going to actually increase in inflammation. So if you sit still and you put ice on it, it's going to help a little bit. But like if you're putting ice on a swollen knee, the ideal thing for inflammation is to actually move. But that being said, you want to absolutely consult your physical therapist prior to that movement, because any type of wrong movement will make that inflammation significantly worse. But ice overall does reduce inflammation. You want to try and do it about once a day, 10 to 15 minutes in order to get the best results. It may, you may do it more than once a day, but you do want to do that 10 to 15 minutes, no longer than that. Don't sit with it on for hours. You can actually cause yourself to get a stiff knee and limit the blood supply too much. But if you're looking to just reduce that inflammation, reduce that pain, ice is the way to go, and it can help reduce inflammation. Heat, on the other hand, while it's not necessarily going to blow anything up or cause anything to inflame even more, can cause a little bit more damage if you are inflamed. So I use the word damage, but it can it's not the best. So damage is not the correct word, but it's not the best thing to use heat. So if you are wondering if you should use heat or ice, always use ice, especially if there's pain. You can incorporate heat if you're stiff. If you wake up, you have a stiff neck, hot shower always feels good. But ice is able to reduce that inflammation, reduce some of that pain. As always, though, you want to figure out what exactly is going on. You don't just want to keep continually icing something and not determine what happened or what the actual cause of the injury is, or anything like that. If you or someone you know is suffering with pain or inflammation and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good day.